Howdy everybody, welcome back to MSK. My name is Jonathan and today we will be going over tears of the rotator cuff. Let's hop right into it. Now before we talk about our etiology, let's go over the anatomy a little bit and so we're comfortable with the muscles and innervation. So above the spine of the scapula we have our supraspinatus and below our spine we have our infraspinatus. So both the supraspinatus and the infraspinatus will be innervated by the suprascapular nerve, and this muscle here will be our teres minor muscle innervated by the axillary nerve, and we will have our subscapularis on the anterior side, which will be innervated by the upper and lower subscapular nerves. Alright, now let's talk about etiology. How do we get these? Well, the most common way is going to be from chronic tendon degeneration that's going to increase our risk of a tear. So this is something more often seen in older patients, especially over 60 years old, because that tissue degeneration predisposes them for a risk of a tear. And of course, repetitive overhead motions may cause an overuse of the muscles that will contribute to degeneration, which will eventually lead to a tear in the muscle. This injury can also happen from acute traumatic injuries, which is something more commonly seen in younger patients and athletes. For instance, baseball players may tear their infraspinatus while pitching, and Kobe Bryant even tore his rotator cuff while dunking the ball off of a fast break. Alright, let's move on and talk about the presentation. So the first thing to mention is that the supraspinatus is the most commonly injured tendon. Sometimes question writers will give you a more general presentation and then ask you what the most likely pathology is. So even though all of the rotator cuff injuries may present similarly, you should keep in mind that if you suspect a rotator cuff tear, the supraspinatus is the most likely injured muscle. So in patients with this injury, they will have limited mobility and pain with shoulder movement. Now in a patient with a more chronic tendon degeneration, this may be onset over weeks to months, and the mobility and pain may be more subtle, whereas a patient with an acute traumatic injury may present with more pain and a sudden change in the mobility of their shoulder. The physical exam test you should know about is called the empty K.A.N test, or sometimes called the Job test, from Dr. Job, who came up with the idea. And this is going to look for supraspinatus injury, again the most commonly injured tendon in the rotator cuff. So in order to perform this test, a patient is going to extend their arms in front of their body and then internally rotate their hand as if they were emptying a can of Heinz beans onto the floor, where Heinz beans belong. Now with their arms in this rotated position, the physician will press downwards on the arm, and if the patient has weakness or that motion elicits pain, that's a positive empty K.A.N test. Now let's talk about other diagnostics. So this is something that's usually diagnosed clinically. Because this is a common injury, if a patient comes in with shoulder pain or mobility, when there was no trauma, or you don't suspect a fracture or any kind of neurovascular damage, a rotator cuff injury is going to be pretty high on your differential. But oftentimes, in order to help confirm the diagnosis, we may take imaging. So we may take an X-ray to show a high-riding humeral head like we see in this patient. So the head of the humerus here is actually a little bit high for the glenoid fossa that's sitting right here. And so because those rotator cuff muscles help keep that humeral head in place, when there's a tear, we can see a slight elevation of the humeral head. Additionally, we may also consider an ultrasound or an MRI, like we see here, in order to visualize the tear of the patient. Now let's talk about management of these patients. So we will recommend supportive care, which will include rest of the injured muscle, physical therapy in order to strengthen the muscle, and pain managements for the symptoms of the patients. So that may be NSAIDs, and it may be injection therapy, which is injecting pain medication directly into the shoulder in this case. And of course, we must always consider surgery, especially for traumatic cuff injuries. You better believe Kobe Bryant got his surgery done. Alright, let's do a quick recap and then we'll do a practice question together. Most commonly, rotator cuff injuries happen in older patients where there's chronic tendon degeneration, but they can also happen from acute traumatic injury, which we'll commonly see in athletes. Patients will present with pain and limited mobility, and don't forget that the supraspinatus is the most commonly injured tendon, and we can test for that tendon specifically with the empty K.A.N test and dump those nasty Heinz beans all over the floor. The patient's clinical history is often enough to warrant a diagnosis, but it may be confirmed with X-ray, ultrasound, or MRI. And while surgery must be considered, non-operative treatment includes rest, physical therapy, and pain management. And a practice question might sound something like this. A 72-year-old male comes into your clinic with complaints of right-sided shoulder pain that worsens with activity. The patient reports that he first noticed the pain about 3 months ago, and his mobility has been decreasing and the pain increasing since. Vital signs are within normal limits, and on physical exam, the empty K.A.N test elicits pain in the affected side. Imaging on X-ray shows a slightly elevated humeral head on the right side. What is the nerve that innervates the most likely injured muscle in this patient? So this is an older patient that presents with limited mobility and pain in the shoulder, and a positive empty K.A.N test will raise our suspicions for a supraspinatus injury. And so we can't forget our innervations. So the supraspinatus, along with the infraspinatus, will be innervated by the suprascapular nerve. All right, that's everything from me today. Thanks for watching. Good luck studying, and I'll see you next time.